Region Economic Bloc now want the Health Ministry to allow county governments to conduct rapid COVID-19 tests to limit the spread of the virus. As Musa Salah now reports, the governors have recommended the enforcement of further restrictions to contain the deadly Indian Delta variant.
Governors from the 13 COVID-19 hotspot counties have questioned the national government's capacity to conduct nationwide tests for COVID-19, raising concerns over the spread of the deadly Indian Delta variant, which according to health experts is fanning the third wave of the virus. In a consultative meeting to deliberate on the way forward in containing the virus in the region, the governors have recommended the restriction of movement in and out of the 13 counties, as well as limit interactions in social gatherings.
The most effective way of stemming the pandemic is to consider a circuit breaker in the form of lockdown in the Lake Region hotspot to control the spread. Well worked out strategy to limit movement of persons while at the same time appreciating the need to maintain economic activity.
Earlier last week, the government revised the COVID-19 restrictions in the COVID-19 hotspot zone, further discouraging movement in and out of the 13 counties. According to the Lake Region Economic Bloc, the number of infections in the region in the last 1 week increased from 1,589 cases to 2,171 cases, accounting for 16.1% of the total confirmed cases in the country. In the last 24 hours, 583 people tested positive for COVID-19, totaling the number of cases in the country to 179,876. The counties of Siaya, Kisumu and Kericho, which are among the 13 counties, recorded high numbers in the daily update by the Ministry of Health. 85 more people have recovered, totaling the number of recoveries to 123,050, as 24 others succumbed to the virus. Governors from Nyanza and some parts of Western now want the Mutahi Kagwe-led ministry to allow county governments to conduct rapid COVID-19 tests before being confirmed by KEMRI to contain the disease.
The capacity for our national government to test all the Kenyans on COVID-19, we must all agree that that capacity does not exist at the moment. So it is incumbent upon the Ministry of Health to allow rapid tests to be undertaken as a first step, because once the rapid test actually identifies that you have COVID, even before a confirmation is done through a substantive test, either through KEMRI, Kisumu or other areas, at least that particular person should start the initial treatment.
We are appealing to the national government or Ministry of Health to listen to our cry. Kilio cha wananchi who want to know their status so that we can intervene much more accurately as counties.
On Monday, Health Chief Administrative Secretary Dr. Mercy Mwangangi asked the 13 county governments to increase their hospital bed capacities and oxygen stocks ahead of the anticipated surge in COVID-19 cases in the region. Musa Salah, TV 47.